With its introduction in the 1940s, the conventional pap smear dramatically reduced the incidence of invasive cervical cancer and is credited with a 70% decline in mortality from this disease. But this drop reached a plateau in the early 1990s. The next major advance came in 1996 with the introduction of ThinPrep, the first significant improvement to the pap smear in 50 years. With ThinPrep, studies from a wide variety of laboratories and academic centers have documented increased detection of low and high-grade squamous intraepithelial lesions. Recent advances with computer-based imaging, combined with human diagnostic experience, further improved the accuracy of the ThinPrep system. Today, the ThinPrep Pap test is the only cervical screening technology approved by the FDA as significantly more effective than the conventional smear for detecting cervical abnormalities, including the improved detection of glandular lesions.
This is the ThinPrep vial where the cells from the cervix are collected for a Pap test. But it doesn't stop there. It's not just a Pap test. This is a library of information about the patient. There are many other things that we can tell about the patient, limited only by imagination and technology. Even now we can do not only the Pap test, we can do HPV testing, we can do FDA-approved chlamydia and gonorrhea testing, and there's going to be more and more and more tests that come down the pike on this vial. It's going to be one-stop shopping, tremendous benefit not just to the laboratory, but to the clinician and the patient as well.
Clinicians that I speak to tell me that their biggest concern related to Pap tests is the potential for false negative test results. I find it gratifying that our work here at SciTech has substantially reduced the potential of false negatives through improved cell collection and more accurate screening systems in the lab. In fact, since its introduction more than 10 years ago, ThinPrep has proven to be an easy-to-use, dependable method for ensuring reliable results.
False negatives come from two sources. 2/3 of them are due to sampling and preparation errors, where the abnormal cells do not make it to the slide at all, or where the smear preparation prevents abnormal cells from being seen or accurately identified. The other third are due to screening errors, where abnormal cells are present but are missed or misclassified. The ThinPrep system directly addresses both of these problems. First, while the sample is collected the same as a conventional Pap, the sample device is then rinsed in a ThinPrep collection vial and preserved in fixative. This ensures that virtually all the cervical cells make it to the lab, where a ThinPrep processor removes any obscuring blood, mucus, or inflammation, and prepares a clearer, more representative slide for review. Second, the innovative ThinPrep imaging system is the only imaging system that combines the power of computerized imaging technology with human diagnostic experience for every slide. Clinical studies have shown that this state-of-the-art process results in greater sensitivity for ASCUS Plus and specificity for HSIL Plus over manual ThinPrep screening, increasing the likelihood that abnormalities will be found and further reducing false negatives.
The ThinPrep method is very easy to use. First, you need to collect a good representative sample of cells from the cervix. Then you disperse the cells in a liquid fixative and send it to the lab. It takes very little time.
Cervical specimens may be collected in the usual manner with either a broom-like device or an endocervical brush-spatula combination. The key is to make sure cells are collected from the squamo-columnar junction, known as the transformation zone. This is an area where the endocervical columnar cells merge with the ectocervical squamous cells. It is here where most dysplasias develop. After collection, it is important to fully disperse the cells into the ThinPrep collection vial.
As you may know, the location of the transformation zone is variable, so you must use a method that samples the whole area. We will demonstrate both collection techniques. Whichever collection device you plan to use, either the cervical brush spatula combination or the cervical broom protocol, appropriate patient preparation will ensure a more successful test. First, advise your patient to avoid vaginal medication or lubricants, vaginal contraceptives, and douches for 48 hours before the exam. Do not schedule the exam during menses. Position the patient in the usual manner and insert a speculum into the vagina. Warm water may be used to lubricate and warm the speculum. As indicated in NACL's, CLSI, and ACOG practice guidelines, lubricant should be avoided. If the patient is uncomfortable and lubricant must be used, use it sparingly. Never put lubricant on the tip of the speculum and avoid transferring lubricant to the surface of the cervix. Perform a brief visual examination of the cervix. If excess mucus or other discharge is present, remove it gently with a dry gauze pad. Next, visualize the transformation zone if possible and collect the sample. To ensure proper collection, follow these steps. We will demonstrate the spatula brush method first. Use a plastic spatula to obtain an adequate sample from the ectocervix. Rotate it one full turn around the entire opening of the cervix. Rinse the spatula in the ThinPrep solution vial by swirling it as quickly as possible in the liquid fixative. Rotate it vigorously at least 10 times to release the cells and disperse them throughout the solution. Discard the spatula. Next, insert the brush into the cervix until only the bottommost fibers are exposed. This increases the likelihood that the brush is in contact with the full transformation zone, even if it is not visible. Rotate the brush 1/4 to 1/2 turn in one direction only. Do not over-rotate. Studies have shown that turning the collection device more than 180 degrees does not increase cellular yield and may cause bleeding. Rinse the brush immediately in the ThinPrep solution by rotating it 10 times while simultaneously pushing against the vial wall. Swirl the brush vigorously to release further material. Discard the brush. If you prefer to use a broom-like device, insert the central bristles of the broom into the endocervical canal deep enough to allow the shorter outer bristles to fully contact the ectocervix. Push firmly but gently and rotate the broom in a clockwise direction. It should be turned a full 360 degrees 3 to 5 times. Rinse the broom immediately in the ThinPrep solution by pushing it into the bottom of the vial 10 times, forcing the bristles apart. As a final step, swirl the broom vigorously to further release material. Discard the entire collection device. Do not leave the broom head in the vial. Whichever collection device you use, tighten the cap on the vial so the torque line on the cap passes the torque line on the vial. This ensures the vial is securely sealed. Record the patient's name and ID number on the ThinPrep vial. Record the patient information and medical history on the cytology requisition form used by your laboratory. Request the lab image your slides. The two unique components of the ThinPrep system ensure more accurate screening in specific Bethesda categories versus the conventional Pap smear, and a 39% reduction in the false negative fraction. Remember, ThinPrep is also FDA approved for HPV, chlamydia, and gonorrhea testing out of the vial, so you can request these tests if appropriate for your patient at the time of the Pap test. These tests may be performed for up to 6 weeks following collection. Finally, place the vial and requisition in a specimen bag for transport to the laboratory.
The Bethesda guidelines were instituted a number of years ago in order primarily to standardize the terminology in cytopathology. Up to that point, every laboratory used different terms for the same type of lesions or processes, and also to define what an adequate specimen is for a Pap test and what the limitations are as well.
Improved sampling has benefited our patients by reducing unnecessary office visits. And since disease is detected more accurately, and there is an increased opportunity to detect abnormalities early on, our patients benefit from more effective treatment.
The ThinPrep Pap test is a reliable, cost-effective tool for detection of cervical disease. It dramatically improves cell collection and presentation, enabling cytotechnologists to make more accurate diagnoses. The ThinPrep Pap test, and now ThinPrep plus imaging, the choice for cervical screening.